Hi, this is Dr. Brian Gruber from Integrated Orthopedics, and today we're going to talk about shoulder dislocations. We take care of many of the high schools across the valley, and oftentimes, for example, on Friday nights we'll have a football player that comes in, or we see on the field with a dislocated shoulder. The vast majority of these dislocations occur where we talk about it out the front. So this is an example of a shoulder model. So the shoulder joint is a ball in a socket, and we kind of liken this relationship to a golf ball and a golf tee. As you golfers know, that ball can kind of fall off the tee pretty easily, and the shoulder is kind of the same way. However, in the shoulder we have a structure that's called the labrum, and the labrum is a cartilage structure that wraps around the socket, which helps deepen that socket. So the shoulder is not nearly as unstable as the ball on the tee type analogy. So what happens is that when we dislocate the shoulder, typically the arm is in what we call this position. We call this the abducted, externally rotated position, and a force is placed on the arm. The shoulder will then pop out of the socket, and oftentimes it needs a formal reduction. So that's either done by us on the football field, or the athlete has to be taken to the emergency room to have a formal reduction there. Shoulder dislocations occur most commonly in contact sports. Football is obviously a very common sport, rugby. However, it's really about arm position. So whenever the athlete can get put, the arm can get put in this sort of position, the risk of shoulder dislocation increases. The shoulder dislocations occur in all age groups. They're most common in athletes in the high school, college level. However, we treat shoulder dislocations from all sorts of accidents in all age groups. The football field, the technique, if a patient or if an athlete is seen early, essentially you can have the athlete in the seated position. You're going to gently raise their arm, and oftentimes the shoulder will just pop back in. After that, of course, you're going to ice the athlete, put them in a sling, and then they will need formal radiographs at some point. Usually they'll go to the urgent care that evening, or if they're comfortable, they can wait and see us in clinic on Monday morning. Typically, after the athlete dislocates the shoulder, we will obtain plain films, x-rays, and we'll make sure that they don't have a fracture. We'll also obtain MRI imaging, and really what we're looking for are two things. Number one, the majority of these injuries have injured the labrum, which is the bumper in the front part of the shoulder. So we call this a Bankart tear, and that's the classic orthopedic term for it. And we'll also make sure that the rotator cuff is in a reasonable condition. To minimize the risk of shoulder dislocation, it really will be to have as much strength and conditioning as possible. Unfortunately, many of these injuries are strictly just bad luck, fluke type injuries, and there's really not a lot of prevention. Athletes can continue to participate, however, with a shoulder instability, and they can do this with brace wearing. And you might notice that when you watch football athletes, for example, on Saturdays or Sundays, where they'll have a shoulder brace, and it prevents the arm from getting in the shoulder dislocation position. So you can still play with shoulder instability, but oftentimes it will require a brace. The risk of a first-time shoulder dislocation is a repeat dislocation, and it is quite common. This is a very, very common injury that we see in the high school and collegiate athlete. And there are very good studies showing that the shoulder will continue to dislocate at a relatively high frequency. Therefore, that we're always quite concerned when we see a first-time shoulder dislocator that could become a pattern. The issue with the shoulder dislocation is it is very unhealthy for the shoulder to continue to dislocate. So the risk really is that you're going to injure the cartilage. So each time the shoulder dislocates out of the socket, you risk further injury to the cartilage. And if you say, what does that mean? It means possibly, in 20, 30 years, you may have an early arthritic joint because of the instability that one had at a young age. Therefore, one of the most common procedures that we perform is shoulder arthroscopy with repair of the labrum, which decreases the risk or eliminates the risk of recurrent shoulder dislocation. Typically with the shoulder dislocation, we start with a course of physical therapy to improve the motion of the shoulder, and then the second phase of that is to improve the strength of the shoulder. Given the fact that shoulder dislocations occur very commonly and you're at a very high risk for a redislocation, surgery is oftentimes performed. This is outpatient surgery. It takes a little over an hour to do it. The technique is called a Bankart reconstruction, and that is basically fixing the labrum back to the socket. So when the shoulder dislocates, what happens is it tears a ligament. It's called the inferior glenohumeral ligament. It's a long name, IGHL for short. And then we have the labrum in the front. So both of those structures are injured initially. So what we do in surgery is we reapply, if you will, the labrum back to the socket, and that stabilizes the shoulder so then it won't be able to come out. The recovery time from a full recovery from a Bankart reconstruction is 3 to 6 months. I don't allow contact activity for 6 months. Early on, we do start physical therapy at 1 week. We progress with the motion, and usually therapy lasts 2 to 3 times a week for up to 3 months. The prognosis for recovery for shoulder dislocations is excellent, and we have a very low redislocation rate after surgical stabilization. Shoulder dislocations are very common. Typically, we do see them in athletes. Oftentimes, they do require surgery. However, the surgical outcomes are excellent from a shoulder dislocation. We invite you to post any comments or questions below. Thank you for watching our video, and please subscribe to our YouTube channel.